How do you know which therapist to choose? Yes, this can be a challenging question with so many therapists out there and different modalities. So once you start looking, I want you to make a list of your top 3 therapists and then make sure you ask them these 5 questions that I have prepared for you. So grab your cup of coffee and join me. The first question you need to ask them is, what kind of therapy do you use? This question is important because there are so many different modalities out there and they are not a one-size-fits-all. There's cognitive behavioral therapy, person-centered therapy, dialectical behavioral therapy, EMDR, and the list goes on and on and on. So no, it's no wonder that it's easy to get overwhelmed and lost. So cognitive behavioral therapy, or CBT, is one of the most researched modality out there, and it has been proven to work. But some people really don't like it because it can be really structured, more so than some other types of therapy. So you can ask your therapist what they use, and then you can look it up and see if it might be something that you would like. So if you're a person that likes to set goals and likes to have things to do outside of therapy and you like structure, then CBT might be a great option for you. But if you prefer someone to listen with less focus on setting goals each session, then a person-centered therapist might work better. Again, there is no one size fits all. So read up a little bit and see which one sounds more like you and something that might benefit you best. The second question is, what is your office like? Do you have fidget toys, sand trays, things I can throw around? What activities can I do when I'm anxious? If you are someone who doesn't feel comfortable going to new places, or maybe you have high anxiety and want to have something to do while you're talking to the therapist in session, then you can ask the therapist about their office and their environment and what they have to offer to help. And you can also ask them if they offer virtual sessions in the event that you're too anxious to come to the office. The third question is, what is your experience with people who are experiencing my issue? This is a really important question because many therapists specialize in treating certain things. So if you are calling to process a traumatic event that occurred in your life, then you probably should reach out to someone who has experience treating trauma and has extra training in treating people who have experienced traumatic events. If you are experiencing depression, then you can find someone who specializes in treating people with depression. When you find someone who specializes rather than finding someone who works with everyone and everything, you will most likely get someone who can help you best, because when they focus on one area, then they have more time and they can devote more time to researching and learning new techniques to help people who are experiencing that particular disorder. The fourth question you want to ask is, do you accept my insurance? If not, what's your pricing? Do you offer a sliding scale? Many therapists don't accept insurance, and there are many reasons for this. However, that information I'll cover in another video. But if you can only pay with insurance, then you need to make sure that the therapist you're calling accepts insurance. And if you plan on paying with cash or a health savings account, then you can ask them for their rates. And if you can't afford it, then ask them if they offer a sliding scale. So this is when a therapist has lower pricing that can help accommodate you depending on your income. And most therapists offer sliding scale. The fifth question is, how often would we meet? Some therapists schedule their clients once a week. They like to keep it consistent, such as your session is on Tuesday nights at 5 p.m. and it would remain that way all the time that you're seeing that therapist. But some of them have you schedule each week, and you might have a session on Monday of one week, and then the following week you have a session on Friday. And you have to know your preferences. If it were me looking for a therapist, I would prefer the consistent schedule because it makes it easier on me to plan out my days and weeks. But if you're someone who has a schedule that's constantly changing, or your work is constantly scheduling you on various nights, then maybe finding someone who's more flexible can help. Lastly, make sure you call a few therapists and ask them all of your questions. That way you have something to compare it to, and you can make sure you find someone who is going to be the right fit for you. I really hope you found this video helpful. Please don't forget to like and subscribe so I can continue to make videos. See you next week.